Now, Dr. Miller, how many days before a person's surgery do they need to fly in? And is there a chance that they can have some of their pre-op work done before they come in, like their blood work or anything?
Sure. So people come into town, if they're coming from relatively locally, a 2.5 hour flight, if they're coming from Seattle, if they're coming from San Francisco, then typically they'll come in just the day before their surgery. We'll meet them that afternoon and talk in more detail, and then we can plan on doing their surgery the next day so they can spend most of their time in town here and most of their time out of work and out of their sort of normal circle of affairs recovering, attention to the surgery. Now, if people come from further, say across Boston, New York, if they come from abroad, then we like them to come in 3 days, 2-3 days ahead of time. And that's because of the travel and the stationary when you travel and whatnot. So they come in 2-3 days ahead of time. They have time to enjoy beautiful San Diego. They get their footing. We meet, go over things again. The plan is never final and never finally committal until we've met and really firmed up the plan. That's good medicine. That's good practice, and that's good ethics, and that's the way we do things.
And that makes the patient feel safe for sure.
Exactly. When we meet, we nail down the final plan. If anybody's uncomfortable at that point, then we go our stepwise. Everything else is preliminary and just lays the groundwork. In that regard, though, we've usually done a remote pre-op over the phone where the nurse has gone over many issues, either Skype or by telephone, and absolutely people can get their labs back in their hometown. So that's all done, and if there's any abnormalities, plenty of time ahead of time to follow up on those and get those all squared away.